Hi there, my name's Amelia and I run a mental health charity in Chelsea called Smart. Now I've been asked to do some myth busting around coronavirus, so here goes, I'll do my best. Something we get asked a lot is whether you have to go and get a test if your partner or someone you're living with has symptoms. And the answer is you don't. You only have to get a test if you yourself have symptoms or the NHS has told you to go and do that. So there you go, that's one thing. A big myth is that if NHS test and trace tell you to isolate, you don't have to do it. And the answer is you do. In this country, we now have legislation that means if you don't isolate when you're told to do it, then you could risk a really, really hefty fine. Now, I know some people are worried about not being able to earn some money from their job if they can't get to it. There is financial support available. So, and this is a big myth coming up. Big myth is that face masks don't work, face coverings don't work. They do, they really do. Yes, coronavirus is teeny, teeny, tiny, but the droplets that it's carried in are much bigger and they can't get past a face covering. So it really helps us to protect everyone around us if we wear them. You may not know if you've got coronavirus, so it's really important to wear the face covering. That's why surgeons do it when they're operating on us. They do work. Another myth, and I know this is a worry for people, is that the police and the government have access to your data if you register with Test and Trace. They don't. We've got really strict legislation in this country, and the only people who will have access to your data are the NHS Test and Trace staff. And then the final myth is that coronavirus and flu are the same thing. They're not. Yes, the flu can be deadly too, but not as deadly as coronavirus. They're caused by different viruses. And coronavirus is really, really serious. So let's all do what we can. Hope those myth-busting facts have helped. And please do get in touch if you need any more information. Thanks.